Hi, my name is Dr. Kay Virdee, and today we're going to be talking about micronutrient deficiencies. Before we get started though, I'm going to quickly distinguish between micronutrients and macronutrients. Macronutrients are substances that we need in large amounts throughout the day, and they include proteins, carbohydrates, and fats. Micronutrients, on the other hand, are substances that we need in smaller amounts but are still essential to healthy functioning. There are conditions like rickets, which are tied to vitamin D deficiency, scurvy, which is tied to vitamin C deficiency, and blindness, which is linked to vitamin A deficiency. A lot of the times, they can also cause subclinical symptoms. And what that means is that you're experiencing general symptoms of unhealthiness, but it's not enough to have your doctor be able to give you a specific diagnosis of why you're experiencing the symptoms you are. Examples of symptoms that could be due to micronutrient deficiencies include insomnia, irritability, muscle twitching, brittle hair, brittle nails, skin rashes. There's just a multitude of subclinical symptoms. As a naturopathic doctor, I've received hundreds of hours of training in clinical nutrition. And clinical nutrition looks at the ways in which deficiencies in nutrients or nutritional imbalances can lead to disease. And I'm trained in detecting them through physical exams and intakes with my patients, and then running lab work if I need to, or how to safely supplement them in order to bring health back to my patients. There's a medical condition that I see often called hypothyroidism, and it's when people are unable to make enough thyroid hormone to sustain their bodies. And a lot of the times I find that these people who are given thyroid hormone oftentimes just have a micronutrient deficiency that causes problems with producing thyroid hormone on their own. So common deficiencies include iodine, zinc, selenium, and iron, which are all requirements that our body has in order to make thyroid hormone. So just a final note on multivitamins. A lot of people take multivitamins because they feel like they're covering their bases, they're getting the recommended amount of nutrients that they need every day. But certain types of multivitamins have nutrients in a form that isn't very absorbable to us. The absorbability of these nutrients is also known as their bioavailability. And if you're taking a multivitamin that isn't very bioavailable to our system, you're basically just excreting out a lot of the nutrients without actually assimilating any of them. At the same time, some people require higher levels of certain nutrients in comparison to others. So multivitamins are kind of like throwing the kitchen sink without really knowing exactly what kind of nutritional support somebody needs. This is why I do recommend that people go to a physician that's trained in detecting micronutrient deficiencies to determine what they may be low in and how to supplement it best. Thanks for watching. I hope you found this video helpful. Leave any questions or comments that you may have below, and stay tuned for next week when we'll be talking about causes of micronutrient deficiencies.